Hi, folks. My name is Melford Bibens. Today, I'm pleased to be joined by Dr. Mark DeBrincat, and we're going to talk precisely about how the GlycoCheck can both impact your patient results and what's going on in your clinic for cash flow and getting everybody to have a higher health score. And we're going to tell you what that higher health score means, but I wanted to get you primed for knowing that there is going to be a way to actually watch your patients increase their health. That's the most important aspect. And we all know it's seeing is believing, and patients actually want to see this. So Dr. Mark, thanks so much for being on today. I really appreciate it.
Oh, great to be here, Mel. Thanks.
Again, I've been blessed to see a lot of the studies on glycocalyx, but I'm sure that some of the folks who are watching this right now haven't gotten the opportunity to see these case studies yet. So can you do me a favor and just break down what diseases are actually made worse once the patient's glycocalyx starts to diminish?
Well, you can imagine being a cardiovascular system, obviously heart disease is going to be at the top of the list there. We also see cancer, okay, because the sepsis, things are leaking through. You're not getting the blood flow to bring your own immunity into the area and get the waste products out of the area. So when vascular stuff shuts down and you're not getting blood flow in, you're not getting toxins out. We see kidney failure start to happen pretty darn quick. And that leads to diabetes and other blood sugar related issues. We see hypertension. We see salt sensitivity, okay, because the salt, the lining, the glycocalyx is a buffer for the salt in your system. And if you don't have that buffer, the salt is leaking into the interstitial space, and then it takes a long time to make it to the kidneys to be able to get it out. So not everybody with hypertension is salt sensitive, but about 85% of the people are. And what they figured is that it's all based back down to the damaged glycocalyx, making you salt sensitive, allowing this to leak out and allowing your kidneys to be overstressed because of that. And so you can go to GlycoCheck.com and see a whole list of multiple studies they've been doing for 29 years with this camera, but especially these last 5 years have been very interesting because we've had a lot of things happen in the planet and a lot of issues with the pandemic and all of that. And so it's been very concerning. Up until now, we've never seen anything be able to actually stick to the glycocalyx. It is the polysaccharide hairs, kind of like a shag carpet that lines the entire surface of your vascular system. And it has redox signaling molecules bound into it. And that layer forms a coat, okay? And it forms a shell and it protects the wall. So the number one thing it does is it just protects it. Number two is those signaling molecules within the glycocalyx are allowing oxygen and nutrients through. So if you have a lot of damage there, you're not getting the oxygen to the tissue and you're not getting the nutrients in and you're not getting the waste out. That lining and the redox signaling molecules also has the ability to tag things in the blood that are swimming by that need to be repaired perhaps, or need to be eliminated because it needs to be out, okay? So it'll tag it, the white blood cells will go find it and eliminate it. And then the third thing, and the reason for that coat in the glycocalyx is the movement of the hair. When it wiggles because the blood's going through, it will release nitric oxide. And that causes vasomotion, which improves blood flow. So when we have a damaged glycocalyx, you're susceptible to all sorts of things. Number one, scratching of the artery wall, platelets stick to it, plaque sticks to it. Now all of a sudden you could have a stroke. You could have a heart attack, hardening of the arteries. You can get leaking and then it gets sepsis. You can get calcification behind the arteries. All of these things happen once that damaged glycocalyx is present.
Well, Dr. Mark DeBrincat, thank you so much for being on today. I really appreciate it. For anybody watching, go to MicroVascularUniversity.com. You can watch this interview. You can see case studies. You can see so much more about how the GlycoCheck is going to impact the health and longevity of your patients. Thanks so much for watching. Have a great day.